Good morning, everybody. I want to welcome you to our presentation this morning. Before we get started, I just want to point out to you here on our housekeeping slide, you have entered the webinar in auto mute mode, meaning that you cannot communicate with me directly. At the end of the presentation, however, there will be time for questions and answers. If you'd like to save any questions during the presentation, you're certainly welcome to do so. And at that time, if you notice here on the diagram, there is an icon to raise your hand so that I can unmute you and we can listen to your question at that time. With that out of the way, what we're presenting today is the second part of the electronic medical record upgrade for Denali within Prognosis. The first part of our webinar, and incidentally, the webinar for the Denali upgrade is actually being conducted in 5 separate sessions. Each of those 5 sessions being conducted once a week until the end of the year. The first part, we dealt with general features at the EMR level. Today, we're specifically looking at orders management. This is one of the biggest features of the upgrade. Now, for those of you that may already be using the function called order sheet, this is going to be an enhancement to you. We have always had the order sheet in Prognosis, but it's been more minimal compared to the way we've enhanced it now. If you've never used order sheet, then this is going to be considered a new feature for you. In either event, it can be used as soon as you get the upgrade based on what we're about to cover. Now, there is a lot of components to the orders management, so we're going to break it down. First of all, we're going to take a look at the aesthetics as far as the user interface and the dynamics of how it's designed, and then we will look at the individual workflows as far as generating an order for each category. First of all, when it comes to using the order sheet, it's at the encounter level. So this is when you're doing orders in conjunction with an encounter. And it can either be accessed directly through your encounter table of content menu by the menu option order sheet. And again, some of you may already have that present. If not, it can be added through the table of content parameters under admin configuration. There's also the ability of accessing your order sheet through the assessment screen, specifically on the ICD tab, and this is through a series of gray buttons. If you see here in my screen capture, the comparison here for those of you that may already be using it, this would be a change. In your existing version 3, you have individual buttons for each order type, whereas now in Denali, there's going to be a single button simply called order sheet. You will notice in both examples the prescription button also exists at this level. Prescriptions are not part of the order sheet. That does still remain an external model. The order sheet itself that we're going to cover in today's session is specifically dealing with lab, radiology, consults, and procedures. And there is a property mentioned here at the bottom where you can hide these buttons. So, and when we get into the workflow, we're going to talk a little bit more about the significance as to whether or not you want to do it at the diagnosis level or at the encounter level. There's a lot of behaviors with regards to diagnoses auto-populating to the order and things like that. So if you choose that you want to only do the order sheet at the encounter level so that it's associated to all diagnoses, then using this property at the bottom, you can hide these gray buttons so that they're not even visible to the user on the assessment screen. But if you want to associate the order to a specific diagnosis, then that is when you want to have these buttons available, because you will order it based on the diagnosis you've chosen at that level. So that's kind of the difference in accessing it strictly through the encounter table of content menu, where it's not tied to a specific diagnosis by default, versus selecting it in conjunction with a specific diagnosis here on the assessment tab. Either way, the functionality is going to be identical. Now, with regards to the user interface, and again, this would be mainly for those of you that may already be using the order sheet, the user interface is completely redesigned. We now are presenting it in an accordion format, which is going to be expandable, collapsible, at multiple levels, and that's what we're about to dissect. In your existing version, this is what it looks like. It's still tabular in the current version, but it is not collapsible, expandable, and oftentimes some of the different components that already exist are through pop-ups. that will navigate you to a different part of the system. And that is where the real design change is, because now within the accordion user interface, basically you're able to do it all from one screen. And not only are you able to do it all on the one screen with regards to the various order types, but that also allows you to manage results for each of those. So it's a complete orders management tool now for the different order types, both ordering it as well as tracking it until you get the result in. It's 4 basic components that we're going to look at. First of all, when you launch the order sheet, you'll notice the number 1 here on the diagram. It automatically launches in full screen, meaning it's going to conceal your table of content. That's one significant change from the existing one, where you notice here the table of content menu remains static on your left-hand margin, and the order sheet is just visible there in the viewing pane on the right. It is now going to open auto launch in full screen, which gives you additional screen real estate, of course, for all the different features we're going to cover. Then you have type tabs. 2 tabs to default here, select and order, as you see under my number 2. And then within each of those sections, you have the various order type tabs. So this is where we start the hierarchy in the different tabs. And as we go into the different workflows, there's going to be even more tabular layers down below. And that is why you get this benefit of being able to do it all within one window. So we're going to look at the difference here between the select tab and the order tab, and then the different behaviors for each order type. Down in the viewing area, tests will be preloaded, and if that test has previously been ordered and or resulted, if you notice the number 5 on the diagram, you will have a direct link to that previous order and or to those results. And then finally, in the lower section, you have your action buttons, which is what allows you to execute the order based on what your workflows are. So that is the generic order sheet on load. You open an encounter, you load the order sheet, this is what you're going to get. So now we're going to dissect that user interface from top to bottom using those 4 major components. First of all, we've got our orders ribbon. And again, what you're looking at here is a completely blank order sheet. Your orders ribbon will initially default empty. As you build orders for this patient's encounter, different tabs are going to appear in that number 1 section. And we're going to discuss how you can visually glance at those tabs and understand what's going on with that order. The second section here, we're breaking down into 2A and 2B. This is the main viewing area of your order sheet, and the content displayed down here is going to be based upon what you've chosen up above at the order ribbon, as well as the select order hierarchy. So this viewing content is what will fluctuate based on what you're doing. The left-hand portion, 2A, is where you're building the order. You're going to search for the test, define your filters to find the test you want, choose the test you want. That adds it over to the right-hand side, where you're going to have a collapsible, expandable accordion at each order type level, and this lets you manage the order details before you actually decide to create it. And we're going to get into all your management details such as scheduling, assigning diagnoses, and whatnot. Now that was on your Select tab, which is our default view. If you notice the number 3, we have an Order tab. I don't have a visual of that right now because that is going to be based on workflows. So as we get lower down into the presentation to each individual order type, the display on the Order tab is going to be very different based on whether or not it's an internal or external order, based on whether you're doing it now or in the future, and so on. And then down in the far lower right again are your action buttons. So all 4 of these major components are what's going to help you manage your orders. So starting with the first component being your orders ribbon. Initially, again, since all of this that we're talking about is in the context of an open encounter, your order sheet will initially default with nothing on the orders ribbon, so it will be completely blank, as you see here at number 1. Number 2 shows you the addition of tabs, and these tabs are color-coded. And the details that display as the label on each of these tabs is where you're really going to be able to visually get a lot of information at one glance. So let's say this is down the road now. The example you see here at number 2 is after maybe a week or 2 after the fact, where orders have already been generated. Maybe you even started getting results coming in the door, and now you're just wanting to track those orders. So the tab color is going to indicate its status. For instance, light purple means it's to be ordered. That means you've not generated the order yet. You're still working on compiling it as far as the test, the details, the scheduling. Dark purple means it has been ordered. And if you see the comparison here in the labels, there's a lot more information on the light purple than there is on the dark purple, because that dark purple simply is going to display the order number. Once that order gets generated, all of the details, such as the vendor, when it's going to occur, what procedure is it, is all contained within the order itself. The orange color simply means that's the order that you're working on. That's the one currently in focus, meaning that's what's displayed down below. The little icon on the tab is going to represent the order type. L for lab, R for radiology, C for consult, and P for procedure. And incidentally, that term C for consult, many clients think of that in terms as a referral. So consult and referral, for the sakes of our order management, are kind of interchangeable. It's when you are referring the patient out for a consultation with another provider. Once that order's actually been generated, then there's going to be a little check mark in front of the icon. So that again is how you're going to know the different stages here. The light purple hasn't been ordered yet. The purple has been ordered, so you see the order number, and if in conjunction with being ordered, you've also generated the requisition, meaning you have e-sent it, you have faxed it, you have printed a hard copy and given it to your patient, that's when the check mark will display. Then the labeling is going to tell you, for instance, in the light purple, who the vendor is, what the name of the consult or referral is that you're ordering, what the name of the procedure is. And then that's what gets replaced with the order number when you actually compile it. Along with that label, you'll see a status indicator. A capital N means now. That means you're ordering it for today's visit. You're going to go ahead and do it right now while the patient's in the office. A number with a letter indicates a time increment at some point in the future. 1W means 1 week, 2D means 2 days, and so on. And that's based on how you schedule it. So again, as you're sitting here looking at it and reviewing at your orders ribbon level, you can quickly see what ones are set for today, what ones are for the future, and so on. In the case of the light purple, when you have not yet generated it, there will also be an X in the right-hand side of the tab, which allows you to delete it from the order sheet altogether. Maybe you've realized you're on the wrong patient, or it's totally the wrong, you don't need lab, you really meant to order a procedure or something. So as long as you haven't actually compiled the order for this encounter, you can remove it. You'll notice on the dark purple and the orange, that little X does not exist. We will get into, at the workflow level, however, how you can delete it even at that level. Right now, we're just at the beginning of creating our order. And then you've also here within this orders ribbon have navigation arrows. So in the far left and the far right, you have your little arrow to either navigate backwards or forwards, depending on how many tabs or orders you have on that encounter. So basically, all of your navigation is going to occur on this orders ribbon. If it's empty, there's no orders yet. As you start adding orders, the tabs will appear, and then based on the color and the status, you'll be able to navigate accordingly. The final thing there on the orders ribbon would be order sheet, order set. Now when it comes to order sets, in case you use those in your practice, order sets can be available at each individual order type level, meaning you can have a lab set, a radiology set, and so on. What we're talking about here on number 3 is an order sheet order set, which can be inclusive of all order types, including prescriptions. So for ease at the physician level, when it comes to ordering something, maybe based on your patient's care, you have a certain local protocol or a regimen that, for instance, we use diabetics a lot as an example because you have lab work, You might want to do their A1C and their glucose. You might want to do a chest x-ray. You might want to send them out for nutritional counseling or an eye exam or a foot exam. So you've got all these different types of tests that you want to routinely order for this patient. Instead of having to go in and order each of them individually, you create it as an order set, and then you can do it in one click. So now underneath our orders ribbon, we get into the actual test level details of an order. So the primary part that is visual when you load the order sheet is our component number 2, which we're going to take in 2A and 2B as far as our discussion. It initially defaults to your Select tab. On that Select tab then, underneath, we first of all are going to have our Add ICD option. Then, as you see, number 1, we have different order types, each of which has its own tab. This is where you define the search parameters, whether you want to look at preferred codes, all codes, only those defined or designated for that patient health maintenance, only order sets. Now, this order set option is specific to the order type. So that's different than the order set we just talked about up above, which can be inclusive of all order types. So here on the left-hand section of our Select tab is where we're going to filter through and choose what tests we actually want to order. And if you notice number 4, there will be hyperlinks when that test has previously been ordered, and the hyperlink is either going to have a symbol of an O, meaning it's in order, not yet resulted. The hyperlink will actually open that requisition, and the R would indicate results, and that would open the results. So that can help you as the physician in today's visit in determining, do you want to just order that same test again, or based on the results, do you want to alter your plan of care for today's visit? Maybe order something different. And you don't have to go search for it off of the document list or somewhere else in the system. Now on the right-hand side of this selection area is where we have the details of each test that we've just chosen on the left. Now on the left we have horizontal tabs, lab, radiology, consult, procedure, as indicated here by the number 1. On the right-hand side, that becomes vertical in the accordion file. So we still have it categorical, lab, radiology, consult, and procedure. We're just selecting it horizontally, and now we're going to manage it vertically. This right-hand side gets populated based on what we've chosen on the left-hand side. And this is all in the context of scheduling and compiling our order. So at this point, it's fair game. We can remove it, we can change it, whatever the situation is. Now our tabs over here, of course, have a lot of detail packed into the little graphics as well. So if you notice, we have a triangle either pointing up or down to indicate if that order type is expanded or collapsed. In the case of lab orders, it's pointing up because there's no lab orders yet, so it's collapsed. There's nothing to look at. Radiology orders is expanded. And that's actually, I need to change the little arrow, the little triangle. I just noticed that. When you have it expanded then, you've got the little folder icon, as number 2 is pointing out, to let you know there's at least 1 or more tests within that category. At the test level then, in the case of lab and radiology, which is what we're looking at on this slide, you have the comment icon, number 3. Now here's where we're going to start to see a little bit of difference based on the order type, because the functionality available to you at the point of order is different for lab and radiology than it is for consultations and procedures. So in this first example, lab and radiology we take together in our webinar today because they're identical as far as the mechanics in the system. So if you want to add comments there at the order level, underneath that is where you schedule it. You can schedule now only, for the future only, or both. As you see in this example, we are ordering a nasal x-ray now. We're going to actually do it today, and then we want to do it again in a week. So you can actually do both orders at the same time. Going through the rest of the options available to you when you have this detail expanded. The test level, if you notice 1A, when the test name is displayed with the X to the left, that means you can remove it. Maybe you've decided you don't want the chest x-ray, you want a chest MRI. Or maybe you want a chest 2 view instead of a single view or whatever. So this would allow you to remove that before you actually create the order and then select the right test over on the left. Once that's been ordered, however, you're going to have an order number instead of the X next to it. As you see down here below number 1B on our procedure tab, the X is not there in front of the CESI, but there's a procedure number in parentheses behind it. So that lets you again know the difference here with one that you've already generated versus one you're still working on. ICD. There's various options for associating ICDs. I briefly mentioned way up at the top, one of your options is starting the order sheet at a diagnosis level, where it would default to that one diagnosis only. Underneath our orders ribbon, we had an add ICD option, which would add ICDs to the entire order sheet. Now we're at a test level where you have a hyperlink for an individual test within a category, as 2A is showing you, or as 2B is showing you, there's an assign ICD button, which is at the order type level. So categorically, you can assign ICDs to all of the individual tests within that one category. On the procedure tab, you have an icon indicating whether it's in-house or external with the direction of the arrow. And then the performing consult provider is going to display whether you're doing it in-house or if you've referred the patient outside. Now, if we notice on the right-hand side of our slide here, we have our statuses also pictured by number 5. The statuses are going to be either approved, ordered, or results received. No change there. Those are the same statuses you already work with under CPOE. So that logic remains intact. This is, however, where you will see a test that has been deleted after you created the order. Up above, we talked about when the tab is light purple. If you realize you don't need it, you just remove the tab completely. It never is reflected in the patient's history. At this point, however, once you've generated the order, if you realize it was wrong and you want to delete the order, that's fine, but it's going to stay present on the order sheet for the audit. It'll just have a red status that says deleted. So that's the Select tab and the two components when you're choosing your tests and adding them over to the right and then scheduling them and associating diagnoses as relevant. Now the Order tab, again, we're going to look at this visually as we get into each of the workflows down below. If you try to click it before you've generated any orders, as I've done in this example, you get an error telling you that you have not yet created the order. Since you have unsaved changes, there's nothing to display. Once the orders exist, however, and you click the Order tab, it's going to be a different story, which we will see down below in our workflows. Fourth component then is your action button. So we started with our orders ribbon. We went through the selection criteria, modifying and scheduling the details, generating the order. Now we got our action buttons, which allow us to either reset, which means undo everything you just typed and haven't saved yet, kind of an edit undo. Save and create order play into our workflows. Save is implying a two-person workflow. Create order implies a single-person workflow. Now, I'm using that term simply for sakes of discussion. You are not regimented into either choosing a two-person workflow or a one-person workflow, and it may vary from one patient to another in conjunction with your local practices. However, for the sake of discussion, I'm using that terminology, and you'll see why when we get down into the workflows, because it triggers different processes within the system. For instance, if you click Save, it is simply going to display that order you've just searched for and compiled as a light purple button. No order numbers there. It's going to display the name of the vendor or the test. It's going to be in an approved status. However, the order is to be ordered or pending, meaning the requisition is not ready to generate yet because it's not actually been created as an order. You've simply compiled the details into something that you want to order. That still gives you the ability of modifying it, deleting it, whatever. Now, based on local workflow, if you choose to use this function, there is a process status. You see referenced here at the bottom of the slide that you can turn on, and that will update the patient routing status on your home page, so that then that second person can determine, oh, I need to go in there now and finish the order. So typically this is going to be used when in a busy practice or in a situation where you have multiple doctors, multiple clinicians, and the doctor simply goes in, sees John Dummy, says, I need this test, and this test, clicks them off on his order sheet, leaves the room, goes to the next room. The MA or the nurse comes in behind him and completes the order, determining, oh, based on your insurance, we need to send you to Quest, or we need to send you to this in-network provider for your consult or whatever. A lot of times the doctor doesn't like to be concerned with those details, but he wants to identify what tests need to be done. So that's when this quote-unquote two-person workflow would come into play, where the doctor chooses his test and clicks Save. Create Order then assumes everything is correct as far as the details. You've chosen the right vendor, you've chosen the right test, you've assigned the right diagnoses, and in a single click, it creates the order so that you can then generate the requisition. So it's a big time saver by going strictly to Create Order, and you can certainly do it. It's just, again, going to be based upon your local workflows in the office, how you want to do it or not. Because when you say Create Order, it immediately adds the order number and puts it as a dark purple instead of a light purple, which means you can no longer maintenance it. All you can do is complete it or delete it and start over. So that is the user interface aesthetically, top to bottom, from the orders ribbon through the action buttons. Now we're going to get into actually building the order and the workflows. First of all, assigning the diagnoses. A lot of options when it comes to diagnoses and orders. A lot of this is going to be predicated on your internal decisions at the point of implementation as to whether or not you are already using auto-population of diagnosis details. For instance, if you notice at the bottom, there is a property that may or may not be turned on in your practice that when a patient encounter is started or an appointment gets marked arrived, all of those diagnoses and medical history on the face sheet auto-populate the assessment for that encounter. If you use that property, then by default, all of those same diagnoses will also be on your order sheet, as you see here at number 1 on my slide. So just below our orders ribbon, there's a diagnosis section there. You have a button, if you see number 2, that says Add ICDs, and next to that button, where my number 1 is pointing, you have a string of diagnoses displayed. This is only applicable if you are using this property at the bottom. So when that patient got arrived, diagnoses auto-populated to the assessment. They're also reflected here. Now there's color coding involved here. Underneath my number 1, there's some in blue, there's some in green, the olive green color. The difference there is whether or not these diagnoses from the patient's medical history are on the assessment or simply on the face sheet, because there are diagnoses that are deemed assessment level, diagnoses deemed not assessment level, if you have copied them or not from medical history to the encounter assessment. Now, whether or not diagnoses are present or not by defaulting, you can add more at this point. So that is why you have the Add ICD button. The thing to keep in mind with this Add ICD button at this level, contrary to what we're going to look at on the next slide, this is order sheet level, which is encounter level, meaning all of the order types below. So if you notice the placement here on the slide, we're underneath our orders ribbon selecting tests, but it's before we've chosen our tests by order type. So this is at that umbrella, meaning every diagnosis displayed here will go to every single test. And that's why it's good for you to determine your preferences locally, because of all those diagnoses on the assessment, maybe only 1 or 2 of them applies to the lab. Another one is warranting the MRI. Maybe only 1 of them is for the procedure or the consult referral. So you may not want all of the diagnoses on all of the orders. But that is going to be the default behavior if you are using this auto-population. Now, when those diagnoses display, if you hover your mouse over, you will get this pop-up that you see number 3 on my slide that gives you the description, because obviously due to screen real estate, we can't display the code and the description, but in the tooltip you will. So if you're trying to evaluate in your mind, do I want to keep this diagnosis or not? and you haven't learned your ICD-10s yet, then you can get the description that goes with it. All of that said, that property right here to auto-populate, there's a new property that controls the level of that auto-population. So by that I mean, you might want to use this property as a whole. You may in fact have it, because usually when we implement new clients, the majority of the clients turn this property on because doctors like all of those history diagnoses to pre-populate the assessment. This gives you the ability of refining the behavior of that property at the assessment level, which does not need to be modified in conjunction with your preference for the order sheet. So if you want to use that property, great. But if you don't want all of them defaulting for all of the tests, then you have this option to define a rule that based on that property or in conjunction with auto-populating past medical history diagnoses to the assessment, specifically to the order sheet now, you can decide which diagnoses will be assigned to your orders. For instance, A is going to be all assessment ICDs will auto-assign to all tests. So that means only the diagnoses that are on your assessment screen will also automatically populate to all tests. X is non-assessment ICDs, meaning it's in patient history, but you haven't put it on the assessment yet. But since it's in patient history, it is relevant for the test you're ordering. Only the primary assessment, both assessment and non-assessment, or nothing will ever auto-assign. So for instance, maybe you do like this property at the assessment level because for billing purposes and for closing the encounter, you're a specialist and you know all those diagnoses in medical history are applicable as to why you're treating your patient. But you don't want any of them on the order sheet because your orders are going to be ad hoc, not necessarily related to their history, but related to today's present illness. So that is when you would choose this option, no, that even though you have it populating to your assessment, they won't populate to the order sheet. Or you can choose one of those other options up above as to which ones you do want to auto-populate. So basically this default behavior is what you want to auto-populate based on the patient's encounter being started. Keep in mind, as within prognosis, all default behaviors have an override. So now we get to the test level. Up above, when we were dissecting the user interface, I mentioned that you have two choices of diagnoses. You have the assign ICD at the category level, which is our number 1 on the slide, or we have the hyperlink, which is test level, the number 2 on our slide. Both of these invoke the ICD mapping screens that you see below. The only difference is at the test level, if you notice in the lower left, you don't choose a test because it's specific to the test you've chosen already up above when you click the hyperlink. On the right-hand side, you have the left-hand panel that lists all the tests for that category. So in this example, my radiology order had 3. We had a bone density, an elbow x-ray, and a pelvis x-ray. So I have an option here within one button, one click, to assign different diagnoses for each of those 3 tests. Or on the left-hand side, I can deselect select for that one test only. So this is where you would modify the defaults. Here, they pre-populated by default when the encounter got arrived because of how I have my properties defined. But now, as I'm completing the order, I'm deciding, do I really want all of these or not? So it's kind of the lesser of two evils when you make your whole decision. Do you want to deselect ones that don't apply? Do you want to click to add those that do apply? Either way, your options are available. It's determined by workflow. So that's getting diagnoses on the tests. Now we're going to get into actually working the orders, building the orders. And again, I'm using this for discussion only, a 2-person workflow versus a 1-person workflow. Comparing the two options, I briefly mentioned this earlier, but just for reiteration, and this will be determined by local preference, clicking the Save button is typically implying that the provider simply wants to identify the tests that need to be ordered during the assessment, leaves the room, goes to the next patient without worrying about administrative level details. The order status can be updated on your home page, as you see there. From arrived or with doctor, it'll say process C for consult, L for lab, R for radiology. So then the medical assistant or the nurse, whoever is reviewing that home page, which remember auto refreshes every 60 seconds, she or he will know that that patient needs to have those tests done. And then go into that patient's chart then and complete the order. And that second row then, as number 3 is indicating, that's when they're going to verify the vendor or the referred to provider based on insurance and preferences and any other factor. Generate the checklist if there is one, give the patient the instructions that are needed, and route them to checkout. So that's what I mean by two-person workflow. Doctor indicates what's needed, someone else comes in and actually finishes it. Create order compiles all of that into a single click. If the doctor or whomever does know up front, they need to go to Quest because they're Aetna, they need to go to MRI Network because they're Aetna, then he or she can just go ahead and say create order. That bypasses all of this additional stepping. So now mechanically we're going to look at each order type. Lab and radiology, again, we take together because they're identical as far as the mechanics. One of the primary differences now in the order sheet versus how you individually order labs and radiology from your encounter table of content options, your tests will pre-populate. If you notice here, number 3 on my screen capture, your tests are automatically here by default when you click the order sheet option. You don't have to click the plus sign, which gives you a pop-up, and then search for your test. So that is a couple of clicks saved. The default content now is based on whether or not you have preferred tests. So that logic is no different than what you already have. If you have preferred tests defined, that's the default. If not, it defaults to all. Whichever the default is, you of course can toggle back and forth by making your choices here. Of course, number 1, you have to choose your vendor. Then you're going to decide, because you may have vendor-specific tests, that is why vendor comes first on our search screen. If you have, for instance, eLab, where you're doing your bidirectional lab order electronically, then only certain tests can go to certain vendors. So by choosing your vendor, the preferred search is also going to be vendor-specific preferred. So that's kind of how you can use this to your benefit by having all of these values pre-default. It saves you from having to do all those additional clicks. You can also navigate to look at only health maintenance, meaning this patient's health maintenance, lab and radiology that are in that patient's health maintenance. So that limits your search down below again. And that's really where you'll benefit from that hyperlink of last order result, especially if you're like family practice and you do a lot of health maintenance for your patients in the primary care arena. Or even in the specialist, of course, where you're wanting to monitor their glucoses or their A1Cs or whatnot. If you're using health maintenance, that's a nice feature because you can very quickly here look at your results from the last visit, look at the results over time, and so on, and make your decisions all within this one window by default without having to pick and choose searches. And then you've got your order set option. All of those choices, preferred all, health maintenance, order set, you can then choose to filter further. And if you follow the arrow here to the right-hand side, your filter options for lab and radiology would be panel, if you have defined panels, test name, category, or in the case of lab, LOINC code. And of course, you got navigation arrows, as number 6 is showing, where you can scroll back and forth. So all of that is pre-populated again. You click the option order sheet, this is there by default. You choose the test you want through any of those searches and filters that you predefine. You simply click the little greater than arrow, as you see next to my number 2. That's going to highlight it in kind of a citrusy green-yellow background. Add it to your right-hand side. So now this is where you start to build your order. You're compiling the order as you go by choosing here on the left, clicking the greater than arrow, which means add it to my order sheet. It shows up over here on the right, where you can then schedule it, modify your diagnoses, and so on. And as we see here in the case of lab and radiology, number 4, you can add your comment. Now when it comes to scheduling, number 5, Clicking it for now, of course, means it's going to generate the order today's visit. Maybe you're drawing the blood right there in the office. If you say future, that drop-down pick list gives you choices, days, weeks, months, whatever, and that is based on the group type follow-up days period, which you have the ability to customize. Once you've chosen all of that and managed your details, now you're going to generate the order. Generating the order, again, if you click the Generate Order button, it's going to do it all at once, and you're going to bypass the light purple and the orange. But if you've chosen the Save option, now to generate the order, let me just rewind here. If you're choosing the two-person workflow, this part is the physician, where he or she is deciding what test to order. Click Save, leaves the room. Second person comes in to complete the order. They're going to choose from the light purple tabs individually and then modify all the details as needed. That's why it's by order type now. And as they click a tab, it shows as orange because that means that's the one they're working on. And that goes ahead and creates the requisition. So now we're going to start to see the order tab populated in our lower section. Up above, when we mentioned the order tab, we didn't see any screen captures. I said we would get to it later. Well, this is the later now. The details of our order tab are going to vary from one type of order to another. So in the case of lab and radiology, this is what it's going to look like. And basically, this is the same that you have today. When you go into your encounter today and order lab or radiology, this is the screen you end up with after you click the plus sign, search for your test. So it might be it's a different color palette, of course, because we've updated our user interface tools. But the alignment of your fields, the logic that you interact is identical. So you can go ahead and enter your collection details if you need to, identify whether it's going to be billed to the client or third party or patient. Whatever those workflows are unchanged at this point. And that, again, is why it might be a one-person or a two-person workflow. Because if those details are relevant in your practice, the doctor may not be the one that does it. He may let his nurse or clinician do it. So once all those details are done, now you're going to click the printer or the fax or the E icon to actually get that requisition out the door and change the status from approved to ordered. So this particular screen is really emulating what you already do. It's just a matter of getting here that has been refined by doing it through the order sheet. Now, consults. This is for those of you that have been using the order sheet in its current version. Consults is one of the pieces that has been enhanced because right now consults are kind of fragmented on the existing order sheet and there was no way of tracking it. There was no way of attaching results and you independently had to navigate to letters out in order to generate the referral letter. So all of that is now self-contained under the consult tab. You don't have to worry about a vendor. So number one is going to be grayed out. The chosen person to whom you're sending the patient for this referral or consultation is chosen at the actual consult order level. So it's not a vendor selection as we saw with lab and radiology. So that option is dismissed. Also, there are no preferred consults in the system right now, so it always defaults to all. However, just as with lab and radiology, this tab does pre-populate. There's a consult master that you define the consults or referrals that you are going to order for your patients. Those will pre-populate here in the number 3 section. And as you see in the details, when you define those, you can associate the specialty as well as a default provider that you want to refer the patient to. You can filter this lower section by specialty or by consult name. And again, you have the option there 4 and 5 of patient-specific health maintenance as well as order sets that you've created. So again, based on your specialty and the type of patient you're treating, there may be different referrals or consults where you're sending the patient out routinely under health maintenance for their dietary consultations or their annual foot x-ray, their annual ophthalmology exam, whatever. So that is what the health maintenance option would be for. Now, when it comes to selecting the consultation or referral that you're ordering, if you notice here at the bottom in the consult provider section that I have circled, when you're defining your consults in the master file, it is optional for you to define a default provider, not mandatory. So that is why within my blue circle here in the lower left, you see some of them have a doctor's name, but the one for general consultation, it simply says assigned provider, and it is a hyperlink. So when you're ordering these, if you choose one that has a doctor's name by default, the assumption is that's where you're referring the patient. So on the right-hand side, if you notice my number 3, when we selected our nutritional counseling, it assumes I'm sending the patient to Christine Mia Baranski. So that name defaults as my consult provider. If I had chosen the general consultation, however, where it says assigned provider, then my consult provider name over here would be empty. Either way, I can change this default doctor. So if I decide I don't want this patient to go to Christine Mia Baranski, I can change it. Or if there was none by default, I can add it now. So next to that provider's name, you have the magnifying glass and the plus sign. The magnifying glass, and this is now where it kind of gets a little more complicated in your thinking with regards to the setup. If you're one that simply does ordering and not the definitions of your master file, there's kind of a crosswalk here because the content of your consult provider master is what is going to determine who you see under the magnifying glass. In other words, if I back up here and go back down there in the circle where my, in the lower left for my consults, my cardiology consult says specialty cardiology. My chiropractor physical therapy says specialty chiropractic and so on. That specialty is auto-filtered in this magnifying glass so that in my referring doctor master, let's say I'm in New York City and I have 1,000 psychiatrists. This is going to be filtered to only those 1,000, well, in this case, nutritional counseling. I'll use that instead of psych. This is going to be filtered to only your nutritional counseling doctors. So you don't have to search through your whole doctor master of thousands of providers. You only have to search for the dozen or so that have the specialty you've assigned to that consult. So that's something to keep in mind when you're creating the consult master. If there's freedom where the patient can go anywhere he or she wants, choose any healthcare facility in your city, then you're going to need to be broad when you define those parameters. But when you define it at a specialty level, when the user now comes into the magnifying glass, the pop-up is going to be filtered to only that specialty. Number 2 allows you to add a new referring doctor. So let's say you're a brand new client or you've never used consults before, even though you've been a client forever, and now you're going to do orders once you get the Denali upgrade in your office. You can either go underneath configuration and add all of these providers or let your users add them as they go. And that's what the little plus sign would give them the ability of doing. Now, generating the order, here we see a difference on our order tab. And now we're going to start to see another hierarchy to our tabular design. So with regards to the consult, our order is actually opening like a requisition and or a letter. Now this is going to be based on your local preferences. When you get the Denali upgrade, by default, you're going to get a template called default order. And that's what you're looking at in this slide for your consults. Because consults are basically a referral, and in your existing world, you go under letters out and you generate a referral letter. So it loosely resembles a letter, but some doctors want it to look like a requisition, like their lab requisition. So you have that freedom of customizing the template. Whether it looks like a letter or not is your choice. Either way, the consult order is what's going to display down here at the bottom. And one of the differences now with the upgrade versus what you currently have is it embeds the letters out user interface, so you don't have to navigate out to letters out independently of your order. This is again why the design of the accordion interface works to our benefit. so that when you're on your order sheet, you don't have to leave the order sheet and you can complete everything. So down here below, if you notice the A option, consult, and then B is response. We'll get to that a little bit later when it comes to resulting the consult. But right now we're ordering the consult, the referral. So we're on our order tab, consult tab. And the content down here is the letter. Notice it looks just like your letters out user interface. You can modify it now if you need to. Change the font, change the verbiage, whatever. And then in the upper right, you've got your icons to either print it, fax it, e-send it, whatever your situation is. And that, of course, at this point, prior to completing it, would allow you to also add in another subject, modify your subject if you want to include a fax cover sheet. This is, again, full functionality of what you have now under letters out. It's just auto-embedded into the consult order. So you can do it all in one screen. You have the functionality, as number 4 indicates, to attach other documents. So whether this is a referral letter or a consult requisition, if you want to attach a copy of your progress note or whatever, you can certainly do that. Now that's the consult tab. You've also got the response tab. So another piece of the upgrade now is consultations can be tracked until you get responses from the person to whom you sent your patient. A lot of times you may request, patient John Smith, I want you to go get this sleep study done. I want you to go have an MRI done. Now the patient's coming back in for their follow-up. You don't know if they ever had it done or not, other than asking the patient, did you actually do it? Well, if you are going to get results in, just like with lab results and radiology results, you can now capture consultation results also. So if Dr. Mia Baranski has now sent you her findings of the nutritional counseling, you can attach those to the order right there inside the order sheet. And then that brings us to procedures. Now, procedures is probably the biggest change with regards to the order sheet and is going to be your biggest decision as far as whether or not you want to use the order sheet for procedures. So before we get into the specific workflows, when it comes to deciding procedures and the order sheet, you're going to have to make some decisions inside, and again, this isn't hard fast, this is just a guideline for using the order sheet. Is it an in-house or an external procedure? Is it to be done today during my current visit, or am I scheduling it for the future? And is it a single person or two-person workflow as far as the mechanics in the system of generating this order? Those are the kind of the decisions that will drive whether or not you decide, yes, I'm going to use the order sheet, or no, I'm going to keep doing it the way I have been. Because when it comes to procedures, I'm going to skip automatically to the lower button, the lower bullet point here. You do not have to change anything in your workflow when you get the upgrade. So even though I'm about to spend 10 minutes going through this workflow, you don't have to do it if you don't want to. You can continue using your table of contents specialty option, generate your template as you already do, nothing has to change. The benefits to you in using the order sheet, however, is what will determine if you want to go that route. The difference is that now, just as we talked about with consults, there could be an order number assigned, meaning you can track it for results and know whether or not the patient actually had that procedure done based on whether or not you got a response from where you sent the patient to have the procedure done. You can also associate a checklist, whether that is a pre-procedure, pre-op screening, pre-certification, benefit tracking, whatever types of issues you need to take care of before you do a procedure. You can have all of this in one place so that it's very easy to manage. And if you do it that way, it will still show up under Table of Contents Specialty, but there will be the added benefit of having a hyperlink to the order sheet so that even under Table of Contents Specialty, you can still navigate through that one click of a hyperlink to the order sheet and view the checklist, view the results. So it gives you the full tracking capability that you have with lab and radiology that you don't have when you simply order the procedure under Table of Contents Specialty. So mechanically, you can still do it that way, but you won't get the new benefit that the order sheet provides of tracking it to the point of resulting and associating a checklist. That said, when it comes to using the order sheet for creating your procedures, similar to consultations, there is no vendor, so that option is grayed out. There is no preferred list, so it defaults to all. You can filter it to patient-specific health maintenance procedures or order set procedures. And down at the bottom, all of your procedures that are defined in your procedure master, which is a new master file, incidentally. That option you see here at the bottom, configuration workflow procedure, that's a new master file with the Denali upgrade that we're going to talk about in a little bit. All of the contents you define in that master file will pre-populate here, as you see at number 6. And it will indicate whether it's an in-house procedure or an external procedure. In-house versus external does matter when you define your procedures because it's going to trigger different workflows. It's going to trigger different screens down here below. The mechanics of ordering that procedure, though, is no different than what we saw in the others. You choose it on the left by clicking the little greater than arrow. It shows up in the citrus color, displays on the right. Now on the right, just as we talked about with consults, you can change your performing provider. Choose whomever. Now this is where, though, the magnifying glass and the plus sign is a little different than what you had on the consults, because it's going to be based on your procedure type. So everything goes back to the procedure and whether or not you defined it as in-house or external. If you notice here on my number 2, when you click the magnifying glass to associate a provider for that procedure, whether you're going to do it in-house and perform it, or if you're referring the patient out to have it done outside to somebody else. The magnifying glass is going to display internal providers only when it's an in-house procedure that you've chosen. So in my example here, number 1, my nebulizer treatment, notice the arrow is pointing inward within the green outline. That means it's an in-house procedure I've chosen. So my magnifying glass at number 2 is showing me my prognosis providers only. And I've chosen Sheldon Cooper. So that's going to be only your in-house doctors that are licensed in prognosis. If you've chosen an outside procedure, however, that same magnifying glass will not open your internal doctor master. Instead, it's going to open your outside organization referring doctor master. So you can choose accordingly. Scheduling it, just as we saw on consults or labs, if you want to schedule it for now, that means you're doing it on today's visit. If you want to schedule it for the future, then you have the pick list of choices that you've predefined in your group type. Generating the order, and now this is when you're actually generating the order, so whether you single-clicked the generate order icon or you're the second person in the 2-person workflow who has now come in and selected the light purple tab to generate it. Either way, when that order gets created at the system level, the difference is what you see here in green. It's either going to open up the letters out user interface if it is an external procedure. In that regard, it basically mirrors what we saw for consult, because when you're ordering the procedure outside of your office, you're generating a referral letter or a procedure order requisition, whatever your choice is. So it opens the letters out interface so you can produce that letter, fax it, email it, etc. In the lower section, when it's an in-house procedure, it actually opens your procedure template because it assumes you're going to go ahead and document the procedure that you're doing. So the content down below is going to be based upon, is it in-house or external? So now we're going to look at both of those choices by procedure type. If it is an external procedure, whether you're ordering it now or future, most of the time your external procedures will be for the future. The slight difference of ordering an external procedure for now is, let's say you're in a medical complex and you're sending the patient upstairs to have something done right now. So you're ordering it now, but it's outside of your office. But more commonly, it's going to be an external procedure for some point in the future. Either way, you're not doing it in-house right now because it's an external provider. So you don't need the template of questions. Instead, you need the order template or the referral letter. So just as under consult, when you get your Denali upgrade, you're going to have a default order template, which you can modify. As we see here at number 3A, it's either going to look like a referral letter, or it's going to look like a requisition, however you decide. So under my procedure order 2A, if we look down below here to 2B, I have 3 tabs now. Procedure, checklists, and attachments that we're going to go through. Again, that hierarchy and the tabular format. For procedures, it goes one step further because the first tab here under order procedure is the procedure order when you're sending it outside. It's either going to be a referral letter or a requisition. And it's embedded into that letters out interface, just as with consults. So you can immediately go ahead and fax it or print it or e-send it, whatever your situation calls for. If it's an in-house procedure, notice down below, we're not getting a requisition, we're getting the template. And it's the same template that you would order directly under your encounter table of contents specialty. If you're doing it now, you can go right ahead and enter the documentation. So just as if you have the patient in the bedside and you're giving them the injection, you go ahead and document all those details right here inside the order sheet on the procedure tab. Or, depending on your preference and workflow, you can also go back to your table of contents specialty, because when you order it here through the order sheet, it automatically adds it to specialty. Slight difference here is, if you notice number 2, you will have a hyperlink underneath specialty to take you to the order sheet. And that again is for the convenience of being able to track it once it gets resulted or to look at the checklist. That number 2 is what you don't have currently. And if you choose to keep doing them manually under specialty instead of the order sheet, you will not have this hyperlink functionality, which means everything would remain external as it is today. That is your choice still. The only other thing you cannot do here, I don't have it circled on my slide, but if you notice right above the number 1, the delete checkbox is grayed out. You cannot delete the template from specialty when it's been ordered through the order sheet, so you need to go back to the order sheet if you need to delete it. So ordering an in-house procedure through the order sheet automatically adds it to specialty with a hyperlink to the order sheet. That's another difference from the external. When you did the external, there's no template involved. So all it did was generate the requisition on the order sheet itself. There was no record generated under specialty. Now, in-house procedure behaves exactly the same in that it's going to open the template here instead of a referral letter. The only difference is once you complete it, all of those questions disappear because you're not actually answering them today. You're going to answer them in the future when the patient comes back. So in this example, I'm ordering the foreign body of the eye removal for a week later. So while I'm compiling my order, I see the questions, but when I complete it, those questions will drop off. So now when I go look at it underneath my specialty, there are no questions because I'm actually going to answer it next week when the patient comes in to have it done. But again, it gives me the template when I'm ordering it because it's defined as in-house. Whereas external, I get a requisition because I'm not doing it in-house. So that's the primary difference when you're ordering a procedure through the order sheet. It's the same tabs down here underneath my order sheet order. It's just under procedure, it will either be the requisition/letter or it's going to be a template that keeps the questions enabled for you to actually document when you're doing it now, or drops the questions off because you're going to do it at some point in the future. In either of those scenarios, if we move off the procedure tab now, notice we have a checklist tab. Checklist is something new to the Denali upgrade also for the procedure order mechanism. If you need a procedural checklist, whether it's certification of benefits, screening questionnaires, whatever, a lot of times you need to go through that type of stuff before you schedule the procedure, before you do the procedure. And currently it's very external in prognosis. We're still using the clinic forms, but now we're automatically linking them to your procedure so that you can very easily toggle between the procedure and the checklist. And again, this would be applicable to internal or external procedures. And then the third tab is attachments. So just like consults, you can now get results. When you've sent that patient out, and that other facility or that other doctor has now performed the procedure and sends you the results, you can now track that and know when it was accomplished. So those are the different workflows: lab and radiology, consults, and procedure. On the left-hand side, it's all basically the same as far as filtering it to through your preferred test or through the different criteria, clicking the little greater than arrow, which highlights it in the citrus color, duplicates it over on the right-hand side, where you can then assign the diagnosis and schedule it and create the order. Creating the order is either going to be a requisition that you can then fax, print, or e-send in the case of lab, radiology, consults, and outside procedures. If it's an inside procedure, it's going to give you the template so you can actually document what you did. All of them then have the results tab so that when the results come in, they're trackable. Now we're going to look at the Quick View tab. Quick View tab is a fifth tab there on the order sheet, but it's not an order type. It's a combination of all four order types scrolled into one big screen. So if you can either do it by type, by going to lab, radiology, consult, or procedure, or there's a property that you see here at the bottom. If you prefer to just have one screen that has everything combined and you just scroll through it up and down and make your choices instead of clicking from one tab to another, that's entirely a user preference. So there's a property there where you can define doctor, nurse, medical assistant, whoever prefers to see the Quick View by default. And then it's going to be everything that we saw up above. It's just all combined into a single tab, meaning you'll do a lot of scrolling. Okay, order sheet setup. Now this is the configuration level setup, a master file level for using the order sheet. Different choices under configuration. Some of these already exist. Some of them are new to the Denali upgrade. Of course, in order to do this, you do have to have appropriate administrator permissions on your user profile. First of all, the consult master. This is where you define the consults or referrals that you're going to be sending patients out for. You name it, you identify the gender, whether it's male only, female only, or both. And then if you notice, number 3 are not mandatory. The name and the gender selection is mandatory. The specialty and the preferred doctor is not. And this is where I mentioned up above that the magnifying glass search is controlled. In this example, next to number 3, I have chosen my specialty of dietitian. So therefore, when I'm ordering my consult on the order sheet, my magnifying glass is only going to give me the dietitians in my community. If I leave that specialty blank, then on the order form, when I click the magnifying glass, I will be able to choose from any doctor in the city within my master file, of course. And then the preferred doctor is just, again, if you have a preference. Maybe there is a particular individual you prefer using, but you only change it when that person is out of network for the patient's benefits or whatever. So it's not mandatory to predefine a specialty and preferred doctor, but if you do, then obviously when you're ordering it from the order sheet, that's less clicks that the doctor or the clinician needs to do to complete the order. And then you can associate the letter template. And again, as you see in the screen example for number 4, your Denali upgrade comes with a default order template. It's going to look kind of like a requisition. Loosely looks like the top piece of a requisition with a letter body. And you can modify that if you so desire. And since it is individual to the consult, you can tailor them. So if you, I know I have some facilities I've worked with where they have certain facilities in town that they refer patients to that require the referral be on their letterhead. So if you have that scenario, you can actually have custom templates per consult if they want to receive it on a specific letterhead or something. By default, however, everything will go to default order template. Procedure master, very similar, with the exception that you here will define it whether it's in-house or external. And then based on whether it's an in-house procedure or an external procedure, number 4 through 6 is different. In this example, we're doing an in-house procedure. So I have a procedure checklist at number 4, a procedure template at number 5, as well as an order template number 6. For external, I don't have the procedure template. All I have is a checklist and a letter template, because external, you're never documenting it in-house, so you don't need an input template. You're just sending them out so you can associate your letter or your referral. When it's in-house, however, you have to identify the specialty input template because you're actually documenting it in-house. So you do have to define that template. And if you notice in the green bubble, all specialty input templates that are flagged as procedural automatically create an entry as an in-house procedure. An extension to that, when you get your upgrade, today in version 3 of Prognosis, every template you have programmed as a procedure template. There's a little checkbox called procedural underneath your template design screen. All of those will automatically come in as an in-house procedure. So you don't have to manually do that. That will happen during conversion. External procedures, however, you will have to define after you get the conversion. And then moving forward, once the conversion is in your practice, every time you create a new template and you flag it as procedure, it automatically duplicates it as an in-house entry. So you don't have to double do it yourself manually. Order sheet, order set. Again, this is where you're wanting to combine a regimen of all different order types into a single option. That is a separate master file. Although up above, when we talked about the Quick View tab, you can also create it as you go if you don't want to predefine it under master file. User permissions. There are permissions required, first of all, to use the order sheet. Now that one already exists because the order sheet does exist in its current format. So if you're already using it, then you won't need to modify this permission. But if you're brand new to the order sheet, you will need to make sure all your doctors and clinicians have order sheet read and update permissions. When it comes to configuration setup, lab and radiology was already there, but we now have consult and procedure masters as well within the upgrade. Of course, you would need to have permissions to update those if you need to. Now, other orders-related features in the upgrade, and some of these were kind of hinted on in our first part of our webinar, our first session, because they're general, but they are specific to orders management, which is why we're including them again here. Under your CPOE tab, there are 2 new choices, consult and procedure, and they behave the same as lab and radiology do for you currently. Meaning, if you're trying to search, did a consult get ordered? Has it been resulted yet? That gives you a patient search. If you go into consult, for instance, this will be every consultation you've ordered. And the status is just as under CPOE lab and radiology. A means it's approved, never ordered, meaning the order requisition has never been generated. O means ordered, meaning that requisition has actually been produced. Whether you printed it, faxed it, or e-sent it, it's ordered. So that's the big difference between A and O. Exactly the same logic that you already apply to lab and radiology today. R means results received. C means results completed, and the doctor has probably reviewed it. When you choose from this CPOE screen, depending on the status is what window opens. If you open an approved or an ordered from CPOE consult, you get the order consult tab because it hasn't been resulted yet, so it assumes you want to look at the order. So you can go in and review that template. If you choose one that's R or C for results received or completed, you get the results tab. So either way, it's opening the consult order from the order sheet, but it will default to the tab based on the status. Also within this window, you can add a new consult order if needed. So you have the add new icon and you can associate the type of consult you want to order. Procedures, same thing. You have the new menu option. Now this is going to only reflect procedures done through the order sheet, internal or external, but if you choose to do it through Table of Contents Specialty Direct like you currently do, they will not be under this screen. And then just as with consults, the status will determine what tab displays, whether it's going to open the procedure order or the procedure result. In the case of an in-house, it would open the template instead of the requisition. And when that in-house procedure has been resulted, you will have a label in red that tells you at what point those results happened. Because up here, you may choose the order, and you may have ordered it on the 1st of the month for the future to be done on the 15th. So when you choose it at the point of ordering, it's going to open it from the 1st. But if the result came in on the 15th, meaning the patient actually came back in and did it, that's why you will see the result updated in Encounter in red and tell you the date it was actually done. So there's always a direct correlation between the order and the result. Whether it was done now, it'll be all in one screen, of course, or if it was done in the future. And you also have the ability of adding a new procedure order from that screen as well. Another new option on your Encounter table of content, there is a new choice called Procedure Order, connected again specifically to procedures done through the order sheet. Not to be confused. Now this particular PowerPoint slide is included for discussion, may or may not be applicable in your practice. If you notice here on my left-hand side, I have an option called Procedures. Lower, I have one called Procedure Order. Procedure Order is the new one with the upgrade. Procedures is something that you may have already relabeled in your practice. During implementation, when we implement clients, by default, your library will usually just say specialty, and then it mirrors the taxonomy of the doctor. Or if you're a pain management practice, you may have us rename it procedures, or pain management, or chiropractic, whatever. So that is something that doctors change. Many of our clients have changed that from specialty to procedure because that's what they're actually doing under that option. That's not to be confused. So if you do have a label that you have already renamed procedures, that remains unchanged with the upgrade, but you will also now have a new one called Procedure Order. And this new Procedure Order is specifically for procedures done through the order sheet. The option that you may have relabeled procedures manually will still be inclusive of ones that you do directly under that option, apart from the order sheet, as well as order sheet procedures that are automatically added to that option. So there is a distinction there between the two. And when you click the Procedure Order option, it actually opens the order sheet version of the template. If you remember up above when we went through the menu option specialty that you may have renamed procedures, it opens the template only, and there's a hyperlink to the order sheet. Well, when you go under Procedure Order, you skip that step of having to click the hyperlink. It automatically opens the entire order sheet portion, which includes the checklist and the results. Another change at the system level in conjunction with this is your document list. Underneath Document List submenu, you will now have choices of consult and procedure. And just as under CPOE, the status of the entry is what will determine whether the document list displays the order or the result. If it's simply an order that hasn't been resulted yet, you're going to see the requisition or the referral letter. If the result has come in, it's going to display the result. And then the last change is with regards to health maintenance. There's also a hyperlink display on the face sheet that opens up the order sheet entry. So that's the extent of the new orders management feature. When the upgrade is applied or is scheduled, you will be notified 7 days out. When you log in, you will get a pop-up telling you when you're scheduled for the upgrade. Once the upgrade's applied, you will start to notice these little yellow pop-up bubbles. That's a new tool we've been introducing over the last year to let you know when something has changed through an upgrade or through a patch or something. Those pop-ups can be hidden for that session only, or if you say don't show me again, you're never going to see the pop-up again. You'll have a shortcut on your taskbar that says New, which gives you the direct link to the detailed progress notes. What I've just summarized here in about 75 PowerPoint slides is a couple hundred pages of tech notes. So if you want to see more detail, you can do so through that. And even after that new bubble disappears, release notes are always part of the system. This is part of EMR. So if you go into your Life Preserver icon to open help, go to R for release notes. EMR is under the turquoise color. On our Resource Center, there is a recorded version of this webinar out there. And actually, I have been recording today's because I've done some updates since the original one. So later today, when I get a chance, I will be updating it. So if you do want the recorded version, it will be out there. There's also a PowerPoint that you can download. So the slides that we just looked at are available under Documentation User Guides. Okay, so that is the Orders Management module. Those of you who are still present, are there any questions? Okay, I'm not seeing any little hands go up, so I'm going to bid you all a good day, and hopefully we'll see you again in a future session. Thank you for your attendance.